So when we look at a mammogram, there's so many things that we're looking for, and that's why it's so important that you have, again, a breast imaging specialist reading your mammograms that have had that exposure to a high volume of studies so that they are equipped to pick up subtle irregularities. On a mammogram, we look for anywhere from maybe a mass that looks like a ball that's more convex, but we can look for areas of asymmetric tissue. There are multiple different entities of what are called an asymmetry of the breast. And why do we care about asymmetry? Because we are all about in breast imaging something that's called pattern recognition. If we see something that's asymmetric in one breast and we don't see it in the same position in the other breast, that warrants that, hey, maybe we need to look at this further. Maybe this is just more than normal overlapping tissue. Maybe this is something subtle, like a very subtle cancer or something of that nature. So for us, symmetry, pattern recognition is really important in breast imaging, and especially when you're looking at a mammogram. So not only are we looking for more solid kind of findings, such as masses, such as asymmetry, such as something called architectural distortion, where it's lines that radiate from a point, has a more stellate pattern. But we're looking for things called micro-calcifications. Now, micro-calcifications look like fine white dots on a mammogram, kind of like little granules of salt. Now, as we age, we as women, we tend to develop micro-calcifications, and 80 to 90% tend to be benign, but 10 to 20% have to end up coming out. So we look for different patterns of calcifications. Particularly, there are different morphologic appearances of calcifications, where some are, we know that these are completely benign calcifications based on how they appear. But then there are some that demonstrate a more suspicious pattern, and then those calcifications would warrant additional testing. We need to look for calcifications particularly behind the nipple, whereas we can have, nipple diseases, things such as Paget's disease. We can have things such as DCIS, which is basically called ductal carcinoma in situ, which is thought to be sort of a pre-invasive malignancy that arises from the milk duct of a breast. So we look for all of these things in the breast, and that if there's anything there that warrants our suspicion, we need to thoroughly investigate it further.